Welcome to the InfoWars Nightly News. I'm David Knight. It's Thursday, October 16th, 2014. Now, I guess we ought to name the CDC actually the contradictions in disease control, because that's what we're seeing increasingly. It's not getting any better. We're going to talk about that tonight. But first, look at the news that WND covered that Obama's Ebola czar has zero medical experience. They say that White House Homeland Security advisor Lisa Monaco, who has no professional medical expertise, was named by the White House as the point person in charge of coordinating the government's response to Ebola. This is not a surprise. We've seen this in Dallas as well. The man in charge there locally, who is issuing the quarantine orders, meeting with the press, deciding what's going to be done, is Judge Jenkins. And of course, he is a Homeland Security Director of Emergency Preparedness in that area. What we're going to see is a political response followed by a law enforcement response. We're not going to see a rational medical response. This story from Paul Joseph Watson today, a whistleblowing doctor reports that the U.S. Army rejected a successful Ebola drug 2 weeks before the outbreak. A former flight surgeon had been working with Fort Detrick to develop treatment. And of course, if you know anything about bioweapons, you know that Fort Detrick is at the center of that. In the story, he says, a doctor claims that he developed a successful drug to combat Ebola with the U.S. Army at Fort Detrick, Maryland, but that the research was inexplicably shut down 2 weeks before the first outbreak of the virus in West Africa. He said in the fall of 2013, his company began collaborating with the U.S. Army at the Level 4 bioweapons facility in Fort Detrick, Maryland, to develop the drug, and that they saw astounding success. But then, according to Davis, the drug, quote, killed 4 of the world's deadliest viruses in a dose-dependent fashion. The Army also noted that uninfected cells in the same cultures were untouched by the drug. In other words, it was non-toxic. However, after the Army initially indicated to Davis and his team that they were ready to move ahead quickly with further testing, suddenly communications completely ceased. He said, our once close communications and cordial relationship with the Fort Detrick team went totally and inexplicably silent. Our phone calls went unanswered and emails unreturned. He said he was stunned when first reports of Ebola emerged in Africa just 2 weeks later. And he says he's followed up since May. He's reached out over 200 times to the heads of every organization involved in this, organizations like the World Health Organization, Centers for Disease Control, various teams at the FDA, the National Institutes of Health, DARPA, of course, and multiple private relief aid organizations. We're seeing this happening over and over again. It is not just the incompetence in the way that they're handling quarantines, medical protocols, not giving nurses hazardous suits to work with an Ebola patient for days. It's not just that. It's that they're standing down with drugs like this that might show promise. An even more interesting case, I think, can be made about the Zmapp drug, which is being touted as a medical cure. Today on Infowars.com, we have a story, is it possible that an Ebola cure is being hidden from the public? Now, of course, at the same time, they're promoting this miracle drug of Zmapp, a tried and true formula that's been around for 124 years. As a matter of fact, in 1901, a German scientist won a Nobel Prize for it, taking the antibodies from people who have recovered from an infection and using them to treat people who are sick currently with the same disease. It's called convalescent serum. It's also called passive immunity. Now, it was used back in 1901. It was used to treat diphtheria and tetanus with good results. It was also used in the 1940s to prevent and to treat measles and hepatitis. Most recently, an outbreak of SARS in Hong Kong. A doctor there used it to treat 70 patients with very good results. Meanwhile, the WHO is saying that it's an unproven strategy. They're saying that they need to do more research on it, but meanwhile, they need to shut down a black market in blood transfusions. Most of the doctors and medical professionals who have survived that we've seen get these experimental drugs as they come back to the West, most of them have also gotten blood transfusions, especially the ones who have recovered. They seem to believe that it's very effective. The people in Africa seem to believe it's very effective. It's a technique that's been used for a very long time, yet they're not doing anything. They could cheaply set up a donor registry and test for blood. They have thousands of survivors that they could put into that donor registry. When they pursue Zmapp, which is based on the same strategy, except instead of using real human antibodies, it uses genetically modified mouse antibodies injected into GMO tobacco plants. It's an industrial, patented, artificial GMO version imitating the strategy that they say is unproven. Why would they do that if it was unproven? Why would they be rushing to manufacture this en masse and let the disease run its course when they could already start treating people with a simple blood donor registry? Well, we see nothing but lies and disinformation and confusion coming out of the contradicting CDC. And this is what we saw this week. We had Obama earlier come out and tell residents that they could not catch the disease sitting next to someone in a bus. Now, at a press conference, reporters from CNS News questioned the CDC director about that because, of course, the CDC has been telling people just the opposite. People who have worked in the field say they believe that you can get it by touching something that someone else has touched. So they questioned him on this contradiction, and what he basically said was, well, no, of course, you can't get it sitting on the bus, but we don't want people who have it to get on a bus because they might give it to somebody. Here's what he said exactly. I think there's two different parts of the equation. First is, if you're a member of the traveling public and are healthy, you shouldn't be worried that you might have gotten it by sitting next to someone. No, the answer to that is no. Secondly, if you're sick and you may have Ebola, should you get on a bus? The answer to that is also no. You might become ill. You might have a problem that exposes someone around you. There we go. That's the inherent contradictions. The same sorts of things that we've seen from politicians who are put in charge of a medical emergency like Judge Jenkins. He issues a quarantine for the people who were living with Mr. Duncan, and then he goes and visits for a very long time with them in the apartment, transports them for 45 minutes, shows up at a press release and tells people, I'm wearing the same shirt that I had while I was hanging with them. That's the kind of contradictions and misinformation we're seeing.